This may look like any other elementary classroom, but the University Child Development School, UCDS for short, is quite unique.
So we're thinking about kids being able to connect with each other.
Mackenzie Hasenauer teaches first and second grade at UCDS, a private independent elementary school in Seattle.
One, we're teaching them like the academic skills and the social emotional learning that we're giving them as well, but we're also really fostering like lifelong skills, starting as early as the preschool age here.
One of those skills is what Hasenauer calls oracy.
So oracy, the term itself, is one's ability to express themselves both fluently and effectively.
And I really like the classroom too.
Harrison is a second grader at the school and one of Hasenauer's students. He likes Pokemon.
What's your favorite Pokemon?
Pikachu.
And learning science, most recently about rats.
Like how much they weigh, how long they are, where are their habitats, what do they eat.
The learning process changed dramatically for Harrison and his classmates when COVID-19 hit years ago.
I was, I think, like 3 years old.
Even at that very young age, he remembers what it was like.
We would always wear a mask. I think like when I turned 4, I think it was still happening.
The pandemic likely worsening a youth mental health crisis in the U.S. The CDC points to studies that show teens are mostly affected and that schools can help reverse this trend.
COVID was an interesting time because we had distance between us and we weren't really coming together to collaborate, to talk to each other and work together. So we really value our students' talking and listening skills, or their oracy skills.
Hasenauer and her colleagues are teaching their young students the importance of face-to-face connection before they're exposed to social media.
If you've had the practice in being able to speak what you're thinking and disagree or agree with someone respectfully, that's going to make you feel really confident and ready for when you're in those maybe a little bit more uncomfortable positions. You have the toolkit.
Every day, kids engage in a class meeting when students discuss the needs of the day as a group, a skill that Hasenauer says encourages connection and empathy.
We're like a team together then. It could make it more stronger.
For Healthlink, I'm Christine Pei reporting.
And joining us live now to talk more about this is Dr. Vin Gupta, pulmonologist and NBC News medical analyst. Dr. Gupta, thanks so much for being here.
Happy New Year. Great to be with you, Joyce.
To you also. Let's start with the COVID pandemic and the total interruption for kids in their day-to-day interactions. What kinds of effects did that have on their development and overall health and mental health?
Well, Joyce, I think we're just beginning to understand that. And some of it came out in the package with Christine, but really that the prolonged lockdowns in some parts of the country, frankly, wearing masks, I'm a pulmonologist. I think they serve their purpose to mitigate the spread of infectious disease, but there's no question the data has shown, Joyce, that they impacted especially young people's ability to communicate, use nonverbal cues, learn facial expressions. And so, when you hear about Mackenzie and what UCDS is doing with oracy, just building these skill sets, in some ways we're building them back amongst a generation that didn't have as much exposure up front. And so truly the pandemic is something that we're still learning its impacts, but I think this is the type of program that can build that type of resilience.
And Christine mentioned that the CDC says teenagers are the most affected group, and schools are considered a critical point of intervention when it comes to mental health. Tell us why that is.
Well, they're the first point of contact often. Either it's family at home, which habits are pretty routine. Sometimes it's hard to pick up on things necessarily day to day, but teachers have that sixth sense, and they're going to be with kids understanding maybe mood changes, and will be a source of early warning should something be wrong, should there be signs of depression like withdrawn behavior, irritability, other signs. But this is something that schools really can play a critical role here. What happened with UCDS, it's interesting. They have a graduate school that allowed Mackenzie to really innovate, step out of her day-to-day for a period of time, think about what she was seeing in the classroom, and recognize that this is the type of program that could be really useful to children, and they really piloted it. So that's something that schools can do at scale. This is a scalable model. It's going to look different based on the school environment, but allowing teachers to evolve their skill set to meet the needs of what they're seeing in the classroom, to try to innovate with some of these programs, critical, especially in this age of smartphones and social media.
Which is a great point because, as you know, not everyone can access schools like UCDS, especially, when you're looking at younger kids. What should parents be looking for when they are choosing a school and the services it provides?
First and foremost, I think things to be on the lookout for if you're a parent, especially if you're worried and digital tools are rampant. Look at signs of withdrawn behavior. Look at signs of if there's been any sleep changes or changes in, frankly, appetite. These are things that early warning signs from a parental standpoint that should prompt you to go and speak to your child's pediatrician to try to get help to see whether or not maybe they could benefit from a mental health provider. It's also an opportunity to engage your child's teacher to see whether or not there are school resources to really step in and intervene, because schools across the spectrum have varying levels of support tools to really help kids, if any of these signs are there. And so it's on parents, most importantly, to do that risk assessment to see if things have changed with their children's behavior, both emotional and physical, and to really ask for help.
And then how and when should parents talk about mental health with their children?
I think we should do so now. This is something, Joyce, you and I have had this conversation over the course of the last several months on public health topics, but we're entering an interesting phase here. Post-pandemic, we're in this era of social media and smartphones where, hopefully there will be congressional action here to help parents really regulate and be an ally here when it comes to exposure to these tools and how we can regulate utilization in the at-home environment. And then, of course, our public discourse has never been coarser. And so this is an opportunity, I think, early intervention here. Think about oracy in your own home environment. Have these conversations. I think it's important to talk about if children are seeing the headlines, hearing the radio, say in the car ride home, talk about their feelings. They're able, from an age 6 years of age and up, to really understand to some degree what's happening in the environment around us. And frankly, you and I can both agree the environment around us is uncertain, it's ever changing, and it's important to really engage here. So think about the skills of oracy. This program, again, you don't have to be at a specific school or in a specific environment to really leverage the principles here that Mackenzie was talking about. You can do it in your own environment.
Dr. Vin Gupta, thank you so much for your insight and for being with us tonight. We appreciate it.
Thank you. Have a good night.